In this next video, I'm going to show you how to mobilize and also how to manipulate the lumbar vertebra. So it depends what lumbar, so obviously you got from L1, 2, 3, 4 and 5. Typically, most osteopaths and chiropractors will focus on, say, L5, S1, they call it LS for lumbosacral junction, and obviously the L4 and 5. But no doubt you can manipulate L3, 4, L2, 3, yeah, and even L1, 2. Now, when we do this one, let's say we want to do the lower lumbar, so L5, S1. So there's many ways of positioning the patient. So I'm going to show you a way that works for me. So you can call it like a lumbar roll if you want to, okay? But it's basically like a lumbar spinal adjustment. So I tend to start from the lower leg. So I normally will place the foot in the crease of the knee. When you read about this in many books, they do talk about, depending on what vertebra, it will depend what position they will place the leg into. But I think to learn to start, place the foot in the crease of the knee. The lower leg, okay, just put in a little bit of flexion because it initiates an opening from below. And typically we are going to open the facet. So by flexing, it initiates an open or an opening. So from here, place their arm onto their hip so they're counterbalancing there. Then what I'm going to do is use his upper arm. So I'm going to cradle his upper arm. I'm not just going to pull his arm. So I'm going to cradle his arm and then slowly pull him into flexion. So from there, so I'm going to hold his arm. Let me do it. Everybody wants to help. Okay, so find the level. So if you find, say, L5, S1, go to the one above, and then I'm going to slowly pull him down to the level until you feel it binding at that level. Try not to go too much past there. This hand onto the elbow. Sorry, this hand onto the wrist, not elbow. Relax, Sammy. You okay? So this is the position he's in. Now, from here, what you're going to do is place your hand through that area in here, okay? So it's almost like your space. Relax, that's it, just let go. So find the level you want to cavitate, and then from here, I'm slowly just going to roll my patient as if they're going to fall. For some, people will cavitate, as in the noise, the click will happen just on this motion. So we're going to slowly roll from there, and you can see I can use my arm through his femur because it's more side bending to open the lower facet. I'm going to try, if I can, to put my body weight up and over, and I'm going to slowly use my body weight to drop down through that. You can use the knee as a lever. So instead of using your arm, because people might not like pressure on the gluteal area here, you can use the knee to simply mobilize the lumbar spine. And this is a lovely little technique just to mobilize. Ask a patient to slowly push up on the knee. Push up, please. So he is pushing up for 10 seconds. And after the 10 seconds, relax, please. Take a breath in and use the knee as a lever and just push the knee towards the floor and just literally simply mobilize. Okay, no thrusting, just mobilize the lower lumbar vertebra. If you do want to cavitate, I'm not going to do the full cavitation here, okay, but I'm going to go through the process. So what we would do, we would bring the body weight over. I'm not going to run through it fully, Bal, okay, so I'm just gently going to lean on you. So my body weight is over here, okay, take a small breath in. And as you breathe out, the movement's going to go down. I'm going to mobilize, 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 and then I would drop down through, okay? The thrust is through the femur because it's more side bending rather than a rotation. When you are thrusting, try not to just use the arm. Use your body weight to go through the arm. So I'm in this position and I'm literally dropping down like this to go through like this, okay? But with a little bit more pressure than that. And then that's how I would perform a standard lumbar roll adjustment. Thank you for watching.